Direct Relief is a global nonprofit organization which focuses on humanitarian medical supply chain. We do this all over the world in over 100 countries, and we also do it in all 50 states and all US territories. Back in December of 2017, we were responding to an emergency event right in our backyard. Direct Relief is based in Santa Barbara, California, and at the time in December, Santa Barbara and Ventura counties were hit by the Thomas Fire, which was at the time the largest wildfire event in the history of the state of California. Over 280,000 acres were burned, over 1,000 structures were destroyed. It did $2.2 billion in damages, and unfortunately has been superseded a couple of times since 2017 by even larger wildfire events, which speaks to, I think, your theme of the new normal, actually. From a public health point of view, beyond just the impact of the fire itself, what our biggest concern was the smoke that poured off the hills. I mean, I don't know if you've ever been in a wildfire event. We were there for weeks on end, and the smoke just sat on Santa Barbara and Ventura and didn't go away. Wildfire smoke is very, very bad for you. It contains unhealthy chemicals. It's inhaled in the form of microparticulate matter, which settles in your lungs. It causes long-term damage. It also inflames short-term problems like asthma, and children and the elderly are particularly at risk. So our problem, what we're responding to is smoke, and our response is to work with the counties and other agencies in Santa Barbara and Ventura to hand out hundreds of thousands of N95 particulate masks. So our problem was, how do you determine where those particulate masks go? How do we best protect the citizens of Santa Barbara and Ventura? And we need to adapt that because wildfire, and particularly the smoke, is very dynamic. So it was about that time that I started using a data set called Facebook Disaster Maps. Now, Facebook Disaster Maps is a data set that uses aggregated and anonymized Facebook user information to track the movement of population during times of crisis. And it does this every 8 hours throughout the entire duration of the crisis. So I was using the Facebook data every 8 hours, not only Facebook data, but many other data sources in combination, during the fire to help Direct Relief figure out what was the direction of population movement during the fire, where are people evacuating to, who potentially gets left behind, how does this align with social vulnerability, and how can we maximize our reach dynamically to extend protection to the most vulnerable. So at a time when we could see large-scale evacuations from parts of Santa Barbara, we could still detect key areas where, based on disaster maps, where population was higher than expected. We were able to, in combination with ground truthing through reports from community members, identify places which would be most beneficially affected by distribution of masks. And this was something that then allowed us to set up points of distribution as we worked through the crisis. It was really the first time, actually, that and I've done this for years, the first time that I could say that we could see what was happening to people at large scale in real time during the course of an emergency. I think there hasn't really been anything like it since the launch of this product about 18 to 20 months ago. And it's since been extended out to a large array of situations around the world. But this was the first time that at the population level, we could think adaptively about response activity. And so in combination, again, with other forms of data and using the ArcGIS platform to make and distribute maps, we were able to get 400,000 masks out to the entire community throughout the region and make sure that people were more protected than otherwise would have been from wildfire smoke. Just really quickly, this works based on temporal aggregation, so it's binned into 8-hour blocks. Spatial aggregation, so it's at 600 meter grid cell level, and spatial smoothing. So it's removing small counts to protect privacy and is using statistical techniques to smooth out some of the peaks and valleys in the data. This is the data itself coming in the form of either a geotiff or a CSV file that gives you the baseline population from 3 months ago, the change in the population the day of at that moment, the percent change, the difference, and the z-score so that we can look at statistical patterns throughout the area of interest. Since the Thomas Fire, we've used data from Facebook disaster maps to help us respond to literally dozens of crises throughout the world. Most recently, in Mozambique, after the devastating cyclones that hit, Cyclone Idai hit the midsection, Cyclone Kenneth hit the north in and around the city of Pemba, and overall devastated not only Mozambique, but also Zimbabwe and Malawi. We use population movement maps to understand pre-disaster evacuation patterns. Even in Mozambique, there are thousands upon thousands of Facebook users. So we could see some of this. We can also look at network connectivity maps because this is all premised upon the ability to connect via an app to the network. And so by proxy, there's a way to measure the strength of the network, and we could evaluate health centers that were proximate to areas of network coverage or the converse, and look at ways that we could understand who we could talk to and who we could not talk to, and how we could collaborate with partners at the Emergency Telecommunications Cluster and NetHope and other organizations to re-extend network connectivity out to those that had been disconnected from as a result of the storm. One of the new things that's happened recently is the release of baseline mapping for the globe in terms of small area population and survey data for age, gender, and other forms of other variables that are relevant to demography. And these are specifically targeted towards health emergencies. Facebook gets a lot of criticism for a lot of things, but I just thought I need to give a shout out because they're doing the right thing here. They're posting these into HDX. You can go to HDX. Facebook has as a user identity on HDX. You can download all of their data. And what this allowed us to do after the storms in the north that hit Pemba was to immediately plug in multi-scale epidemiological models in collaboration with partners at Harvard School of Public Health, and begin predicting the spread of cholera in the immediate aftermath of the storm that hit Pemba. And so that ability to kind of move across scales to be able to link that response up with vaccination campaigns through the Ministry of Health and through the World Health Organization, and then to target medical resources for treatment of cholera patients was just absolutely vital after the fact. And so as we learn all this stuff, we can make sure that people receive life-saving medicines and medical supplies that they need for long-term disaster recovery. And we have to extend our deep thanks out to not only the data providers, in this case through Facebook, but also to Esri for making the platforms that allow us to actually ingest large data sets that are at high temporal and spatial resolution, manage that effectively, and make useful decisions sort of in real time as we're responding to health crises from Santa Barbara to Mozambique. Thank you very much.